Right now on 12 on Health, new advances to stay ahead of surgery patients' pain. This is 12 on Health with Gillian Neff.
You're watching 12 on Health. I'm Gillian Neff. There's a new way to administer pain medication to orthopedic surgery patients, and it ensures pain relief even after the patient heads home from the hospital. It's called the On-Q C-Block Pain Management System. Here to describe how it works is Stanford Hospital anesthesiologist Dr. Teresa Bowling. Thanks for being here.
Thank you.
This sounds brand new.
Actually, it's a technique that's been around for at least a decade, but is new at Stanford Hospital. Basically, we initiated the program in November of last year, starting with patients that were receiving total knee replacement surgery, and targeted them for improving their postoperative pain management.
So typically with total knee replacement, they would experience quite a bit of pain right after surgery?
Certainly they have significant pain, not immediately after surgery, but even for days following surgery, and that can impede their physical therapy, which is one of the critical things in having successful total knee replacement.
I'm always surprised that after something like that, the doctors and nurses want that patient to get up.
Yeah, they like to get the patients out of bed as soon as possible, and rehab actually starts postoperative day one.
That is amazing to me. I've seen it go on where they, have them put their legs over the bed and then stand up a bit. It's like, whoa, they were just in surgery.
That's correct.
We want to show folks how this pain management system works, and you provided us with this video. Now the patient, headed into surgery, but toward the tail end of surgery, what do you do here?
This is actually prior to the surgery. The placement of the catheter is done by the anesthesiologist here, which appears to be in the femoral nerve area for some kind of knee or ankle surgery. A nerve stimulator is used to guide placement of the catheter, so the tip of the catheter is adjacent to the nerve that transmits the pain sensation from the leg to the brain.
Okay. And this will be the port, that is now the catheter in place for the pain medication?
Yes, the pain medication is delivered by a unique pump, the On-Q C-Block pump, that continuously administers local anesthetic or numbing medication to the nerve, and that thus blocks the pain from being transmitted from the leg to the brain.
Okay, so that they go home with that pump in place.
They can be on an inpatient service, like a total knee replacement, but now currently at the hospital we are sending home patients on an ambulatory basis. The unique thing about this pump is its simplicity. It's very easy to use. It requires no maintenance or intervention by the patient or their caregiver. It is set at a preset rate prior to their departure from the hospital by the anesthesiologist, and it can stay there for 48 hours, and it is actually removed by the patient and discarded in the trash by the patient or their caregiver at home.
Can they shower with it?
No, the dressing cannot get wet. It has to stay dry for the 48 hours, but after it's removed they can shower immediately.
And are there any concerns of infection when the patient goes home with this, because there is that opening to their body?
Remarkably enough, there's been no incidence of infection with this catheter.
So it's really worked out so that it's in there very tightly, but also wrapped real well.
We put a clear sterile dressing over it, and it's taped securely to the patient's side, and then the pump is placed in a black pouch similar to a fanny pouch that can be placed over their shoulder or on their hip if it's a lower extremity procedure. Why
is this better than, say, giving them a prescription for pain medication?
Well, this is actually local anesthetic. It's got no narcotic medication in it, and narcotics traditionally have side effects associated with them. The wonderful thing about this product is that it decreases the need for postoperative narcotics in these patients, so they avoid all of those side effects.
Is that because it's sending the pain relief directly to the area?
That's correct, and it's local anesthetic. It's not narcotic, so it has different side effects, none of which narcotics have, like nausea, vomiting, sedation, and other issues that can be really troubling for patients postoperatively.
And addiction.
Not necessarily in the postoperative patient where they need pain medication. In fact, many patients with this pump still need some kind of adjunct therapy, but it's markedly reduced, and patient satisfaction is incredibly high.
Really? And what are the side effects of this?
Basically, the limb is numb, which is the desired effect because then you have no pain in that limb. But with that comes some precautions, especially if it's in the lower extremity where patients may have difficulty ambulating.
Okay.
Most of these patients that are going home with these catheters for lower extremity will be braced and or on crutches, and they certainly need assistance at home. Not every everyone is a candidate to go home with these catheters. You have to have at-home assistance.
Because for those 48 hours while they have this pain pump in place, if they can't feel their limb, they could injure themselves.
They could fall, certainly, and they're all sent home with detailed instructions about fall precautions. And as well for upper extremity, they're usually in some kind of sling or immobilizer and given detailed instructions about what to look for.
Are you ever on the fence about the fact that the limb is numb, so therefore they can't do the kind of standing up and walking that they would do without it?
Well, most of these patients, especially for lower extremity, they're not going to be weight bearing anyway. They're going to be on crutches.
Okay.
And after the 48-hour period when the catheter is removed and the numbing medication wears off, that's generally when they're getting ready to start putting some weight on that limb.
And at that point, what medication might they be on for pain?
Well, the nice thing is they're 48 hours post-operative, so the acute pain has really subsided. So very often they can just be treated with over-the-counter Motrin or extra-strength Tylenol.
That works out well. You get them through the toughest part.
Exactly.
Thank you so much, Dr.
Thank you.
Bowling.